Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Okay, Vincent, so tell me what's going on with your elbow, what happened?
I was pitching
Mm-hmm.
and they just started hurting like in the part of my elbow.
Right in here?
Yes.
So how much pain from 0 to 10? 10 is emergency room.
6.
6. Okay, what kind of motion causes the pain?
When I go like this.
When you extend?
Yeah.
Okay, what about?
And when I'm like going through the motion of pitching.
Yeah, okay. So now when you do it, how much?
When I go like this, it hurts like a 7.
Okay,
When I
7.
go like this, it hurts like a 5.
5. And you feel it in this
Yes.
area. How long has this been going on?
For about a month.
How did you heard it?
Pitching.
Okay. And did you have any treatment?
No.
Okay. So I'm gonna take your range of motion and let me know if you feel any pain with that. Okay. So let's see the extension. Straight your elbow like this, and how much pain is that?
That's like a 7.
Okay, that's like a 7. So it's in here. He missing 15 degrees. So minus 15 for extension. Okay. Right. What about flexion? Is that as far as you can go? The pain? This is not the best position. I'm usually doing lying down, but because the camera.
This is part of my work.
How much?
6.
6. And this is. 1 second. Okay, this is not bad actually. It's 140. It's 142. 142. Extension we said minus 15. It should be 0. It should be 0. This should be 145, 150. That's fine. Okay, so now we're gonna take the supination and pronation. So you said this, like when you twist it this way, yeah?
Yeah.
Is that painful?
It feels like a stretch.
A stretch in here.
Yeah.
Let's do it the other way. So that's a normal range of motion. Should be like 80 or 90 degrees. So
Okay.
that's totally fine. You can see here it's twisted, but you feel the tightness here. You feel the tightness here or in here? Okay. Is that painful here?
Yes.
So he has classic golfer's elbow. Right in here. Is that painful?
Not when you squeeze it like that.
So relax. So nice and tall. Make sure what I'm doing is not painful, okay?
Okay.
What about your wrist? Do you have any issue with your wrist? Up. Okay, this is fine. You had any bruises here or just your vein?
That's in my veins.
Okay. So make sure it's not painful, so it's right in here.
Yeah.
How much pain when I touch you there?
About 2.
About 4. Okay. Did you feel it during the game or after the game?
I felt it after the game.
Okay, is it too much?
No.
How often do you practice?
2 times a week. Yeah.
2 times a week? Okay, that's not bad actually. You feel the tightness here?
Yes.
Okay. Is it painful what I'm doing? Make sure what I'm doing is not painful, okay?
Okay.
So I'm actually doing deep release for the tightness he has.
Okay.
Okay. How's it feel?
Feels good.
You said you did massage on him? Just a little
Slightly,
bit?
yes, whatever I could
Mhm.
do.
Yeah. It's hard to go that deep with the massage. Do you see how much deep
Yes.
it's going in? You cannot see the head. Look at this.
Oh,
It went all the way in. And actually, I'm not all the way in. I'm just because I want to make sure he's tolerated, and that's why, it's hard to do that with massage. You cannot really go deep.
can't get all the way down.
With your thumb, with your elbow, it's very thick. You cannot go deep. It's just mechanically impossible.
Yes.
So, and we need to release the deep fascia there because it's very tight. I feel it here. You feel that tightness here?
Yes.
And you can see my hand is just rolling over.
I felt a lot of bumps.
Yep,
when I was
this is
massaging.
scar.
Yes.
This is scar tissue. If you want to feel it with the tool, I will let you feel it. It's actually very easy to feel it with the tool.
Okay.
Yeah, because you can feel more the superficial scar too, not only the deep. Is that too much?
No, it's okay.
Okay. Is this the first time you have golfer's elbow?
Yes.
And you feel this bump here?
Oh, yeah.
Is it painful? It's okay.
No, it's okay.
And you can see my finger is just rolling over like a little rope, like a string.
Yes, I
Like a
felt
string.
that.
You felt that
Yes.
string? Yeah. So that's string because we have a fascia layer. That fascia is like very thin layer that's wrapping the entire body. That's the superficial fascia layer. There is a deep layer that's wrapping each individual muscle and each group of muscle and each bundle of fibers. So when the fascia is tight, it's like you're wearing a t-shirt 2 to 3 sizes too small. So it compresses on everything underneath it. That's why you feel that rope,
Okay.
because that fascia layer doing this. So can you feel like, try to move your bicep. Do you feel tightness here when I'm doing
Yeah.
this?
That's what he's feeling right
That's what the fascia does. So it's hard to release that with massage. So I'm trying to get deep to release it. Is that too much?
No.
Okay. See, I'm going all the way and you cannot even see the rubber here. Sit up nice and tall. Nice and tall. Okay, here you go. And here. You feel it? Sorry.
It's okay.
So this is the area or it's more in here?
It starts from right here and it's like right here.
And you said you feel like a sharp pain or something
Yes.
like that. Let's roll this up. And then he has a knot here in his biceps. Right here. Is it too much or is it okay?
No, it's okay.
And here. You get a little bit bruise here. What's going on?
Probably baseball when I slide.
Yeah, you slide. Okay. You remember when that happened?
No, I bruise easily.
You bruise easily?
Yeah.
Yeah, he has a lot of knots.
Mm-hmm.
Okay. Is that too much or is it okay?
That's okay.
You see how it's tight? I'm pulling the fascia, but it's pulling
not
his
going.
whole
Yes.
his whole arm. You see, it's all connected. You cannot separate it. That's how tight it is. Because if it's not tight, it should not be pulling that. You see? And I'm actually grabbing with this. How does that feel?
Good. It feels not painful. It feels like it's stretching on you.
Stretching? Yeah. As long as it's not painful, that's fine. You can relax this arm, just keep your hands up, but you don't have to hold it. So just... Do you get pain going down here, or just...
No, it's just more on my elbow.
the same?
Yes.
Okay, so now I'm gonna actually work on the scar tissue and I will show it to you.
Okay.
You will see more redness where there's a scar tissue and you're gonna see the tools going over, like a kind of like going over like rocks.
Okay.
Because normally it should like feel like nice and smooth. Okay.
Okay.
Ready to start feel it, yeah? Do you wanna feel it?
No, I'm like,
You see here? You see the tools is like vibrating right on the scar tissue, and you're gonna see redness actually where he has a scar tissue. You hear that? I don't know. I can hear
I
it.
can feel it.
He
I can
can
see the
hear
pump.
it. What?
I can see the pump right there.
You see? You see? It's
Yes.
just going like this. It should feel like nice and smooth here. You see that? Nice and smooth compared to this.
Tightness. Awesome.
Yeah. So I feel it like a green here, and here in this area. So you're gonna see more redness, like red spots where the scar tissue. If it's really bad scar tissue, you will feel like in the whole area.
Oh, okay.
But if it's like little spots, it depends on how severe the scar tissue, and you can see it here. Okay. I did not do much work. And you see the redness here. And look at the difference here. You see, this is normal color here. And
On
scar
this side,
tissue.
I see.
You see the difference between the
Yes.
color? So we can actually, with this tool, with ASTR tool, we can see the location of the scar tissue. I definitely can feel it here. He can feel it.
Yeah.
But you also have visual, you can visually see it. The good news, actually, after a few treatment, it's not going to be that red. It's going to be just little spots because it starts shrinking.
Okay.
So that's another way to see how, how much was broken from the scar tissue. And this is a really good example here.
And right there, you just moving it back and forth. Not, are you applying any pressure?
Oh, yeah, I have to. Yeah, I have to apply pressure. Okay, let me show you this. This is actually a good visual here. Okay, look here. It's like a little spots. See this white part, this normal skin, and little
Yes.
spots of scar tissue.
That's right.
You know, here there's more scar tissue, so it's the whole thing is red. And here, is it too much?
No, it's okay.
And here where he has a big knot here. Make sure it's not painful, okay?
Okay.
He has more than his biceps too. Yeah, it's very typical with the throwers. Yeah, that's very typical.
Good to know.
Yeah, so that's it's a common injury. And here you feel that. Okay, so we're gonna give you some water, and I want to actually. So you said it was 7, around 7 or 6, like extension, and he was minus 15 degrees. So I want you to drink some water. Okay, so let's move your arm and tell me how that feels. Extend and flex. How's that?
It feels like.
Do you feel pain or it's gone?
I just feel a little bit pain.
How much from 0 to 10?
Like 3.
So 1 down to 3 here. What about bending? How's that?
Barely even feel pain.
What about this motion? Oh, look at this. He did not do that before. He was like moving the gears. Are you trying to show off now? Just show. So you feel it here? Did you feel it with this motion or just extension?
It was just the extension, and with this motion, I barely even feel pain.
Okay, so with extension, feel it here. But actually, after we're cleaning up, you can really see the map of the scar tissue in here. Most of it actually where he has the golfer's elbow, which is medial like this. So it's in this spot here. Make sure that's not too much, okay? Not too much. So he probably have. Try it again and tell me how that feels. 0 to 10.
Like a 1. Wait, no.
Let's move it back and forth.
Oh yeah, like a 1.
Like a 1. So he probably have a little bit of inflammation there. So I have a special tool, it's called Magneto. This is a special magnetic that's actually coated with anti-inflammatory. And that's what I use for inflammation. So we're gonna check the temperature, and you're gonna see redness here where he has more inflammation. In the screen I will show it to you, it's just loading now. Okay, so I'm gonna take a picture and I will show it to you. He's actually around this area. He has a skin 20. 93.3.
That's on that.
That's a temperature there, and I will show it to you here. Actually, I will show you the picture. Okay, look here. You see that redness?
Yes.
And you see that temperature here. There's a temperature here. You see that temperature? 93 degrees, and this is 91.9. All that redness, there's increased temperature compared to everything else around it. This is 67 degrees. Okay, so I'm gonna work on the inflammation, and that's actually more where he has a lot of
Scar tissue.
scar tissue. So we're gonna do this. And let's see. It's more in his biceps and the medial part of his elbow. Did you see it? Or I didn't? I showed it.
Oh, yeah, I did see it.
You saw it, okay. So, what I try to get is decreasing the inflammation. Hopefully we'll have it shrink a little bit. Actually, let's see. $89 degrees.
Oh.
Okay. So let me show you. I did not even spend a minute on it. Okay. So I'm gonna show you the recent picture. So you see 89 degrees and smaller. See this?
Yes.
And this went to 90 degrees. Okay. I'm gonna show you the next one. 93 degrees. 91. Can you see the difference?
Yes.
We'll go back.
Wow.
In just a few minutes, like not even a minute. So definitely has a little bit of inflammation. It's not too bad. I had patient actually worse than that.
Okay.
But that's you know we can tell how much is the temperature here. Okay, so let's actually do the extension and tell me how that feels. 0 to 10.
It's like a 0.5 when I go like this.
0.5. Let's drink more water.
I don't feel no pain, but when I go like this,
Mm-hmm.
I start feeling a little bit like here.
How much from 0 to 10?
Like a 1.
Where do you feel it?
Like right here on the
Okay, so that's a different area than the area I worked on. So let me put it in one in here. So he has a little bit inflammation, not too bad. Okay, let's drink more water and try it again. How much you guys feel? How's that?
I don't feel nothing.
Mm-hmm.
I'm good.
So that's a classic inflammation because this is the only tool used for inflammation. So that was like a 3 degrees. How's that?
Feels way better.
See how fast he's moving, and he's doing motion that he did not do it
You
before.
wasn't doing before.
Okay, how much was the extension?
-15.
Negative 15. So that should be the normal is 0. Oh, look at this.
Wow.
He's actually like he was negative 15. Now it's positive 5. So it's like 20 degrees. Look at this. Nice. Okay. What flexion? How much it was?
142.
142. All the way. Okay. There it is. 155. You see this? 155.
Yes.
That's normal, actually, normal range of motion. So move it around again. How's that? Any pain or it's gone?
It's gone.
Okay, you can turn it around. And tell me, what do you think about the treatment? Have you had any physical therapy before?
Oh, physical therapy? Like,
For any other injury?
Oh, yeah, my knee.
Can you tell the difference between ASTR and the other approach that you had before?
You're working on it way more. Yeah,
Yeah, okay. Any pain, any discomfort, or everything's okay?
everything's okay.
Awesome. Thank you. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.